Okay, welcome to TEMSIS Tips. This is the first installment of TEMSIS Tips. These tips are roughly 2 to 3 minute video clips dedicated to improving the documentation of TEMSIS, electronic patient care records. Hopefully you'll find them informative and helpful. Today we are going to talk about aspirin administration and documentation. In early November of 2014, TEMSIS data showed that we, as New Hampshire EMS providers, were only administering aspirin about 55% of the time to patients with cardiac chest pain. This is a big chunk of aspirin missing from the data. So, when we looked at a 1-month sample of electronic patient care records where aspirin was not reported, we found that 30% were documenting aspirin in the narrative instead of documenting it in the medication section. Surprisingly, 56% did not document aspirin administration in the medications or even mention it in their narrative, but that's a different subject altogether. All in all, we decided to focus on the 30% that were documenting aspirin in the narrative. So here is how you document aspirin in your electronic patient care record. Okay, as you can see, I've created an electronic patient care report in the testing site of TEMSIS just to do the demonstration. When I have a patient that presents with cardiac chest pain, I choose chest pain under the primary impression and cardiovascular under the organ system complaint. This triggers a validation rule to remind you to add aspirin to the medication tab. Now I'm going to enter aspirin to the patient's record by adding med and choosing aspirin. Now I check off yes to prior to our arrival. Many times our patients have taken aspirin prior to our arrival because either 911 told them to, or they saw it on television, or a family member asked them to take aspirin. In just 20 days, New Hampshire EMS providers stepped up, and now aspirin administration is up over 82%. That's a great job by New Hampshire EMS providers. So keep up the great work and stay safe.